I'm very happy, and I have the pleasure to have with me Professor Gaetano Rocco, the editor of the Journal of the ESTS, and I would very much like to ask you about how should the trainees should write a good paper, and of course what are the closing remarks and how to consider about them and how to have them correctly written.
Yeah, you refer about the session that we just had upstairs, and the session was about the best papers in 2018. We tried to collect a series of papers that could be of interest to the majority of the thoracic surgical community, whichever their interest may be. We selected clinical research papers as well as translational research papers. And those papers had the unique common peculiarity of being updated and bring information that are absolutely new to the thoracic surgeons. And my role and Professor Gonzalo Varela's role was to try to identify how to select the most important papers to read during the year, let alone 2018. And my closing remarks were about the importance of some specific papers would deal with lung cancer screening with minimally invasive thoracic surgeries, which are very much linked together, about ERAS, about quality in thoracic surgery, as an example, the completeness of mediastinal nodal dissection, and of course, last but not least, the immunotherapy. So I have outlined the most important papers, and I think we all, Professor Varela, Dr. Bott, and Paula, we were able to, Paula Moreno, we were able to give a very extensive review of what the thoracic surgeon should know from 2018.
Oh, that's great. Are there any criteria or any hints that you could give us for what to select and what to read during the year?
Well, you know, Dr. Varela was very precise in telling everybody that we should not really be focused on the p-values in the abstract, but we should really read the title and focus on the meaning that the particular paper would have for us. He told us how to make a search actually on PubMed, one of the engines that we allow us to search for our predefined papers, how to collect them in a way that we don't lose track of our previous preferences. So we gave a lot of information, and I think was a successful session, even looking at the numerosity of the audience. So we're very happy with that.
And of course we should stress that all the thoracic surgeons should be updated from the Journal of the ESTS, of course.
Of course. Thank you.
Thank you very much.
Thank you.